Welcome back. Talk the 9 o'clock hour here on the East Coast as we cover these twin stories tonight. A primary night, yet another one across America in the midst of a pandemic. And as you know, if you've been following the news, the Bay Area is under a virtual lockdown. 6-7 million Americans being told that kind of post 9/11 euphemism to shelter in place. It's a fancy way of saying stay home, stay where you are. A lot of folks are experiencing just their first 24 hours of life under lockdown in the Bay Area. Indeed, NBC News technology correspondent Jake Ward is under that shelter-in-place order in Oakland. Jake, what was day one like?
You know, I would say, Brian, it was a test for all of us. My wife and I went into this thinking to ourselves, well, you know, what are our goals for this, aside from just obviously staying healthy? You know, mine was sort of loose. You know, I thought, well, we'll just kind of, you know, hang out and do things. My wife said, no, we need to set up a structure and create some semblance of normalcy, and she was absolutely right. So we've been trying to do the things that all parents here, and I think eventually all parents across the country are going to have to do, which is homeschool your children, work a full-time job so that money continues to come in, and take these sort of deep inventories of your food, of your emergency supplies, all the things that, you know, we've been told in the past we needed to do but haven't done before now. I will say, as someone who was in New York on 9/11, you know, it brings back a lot of those feelings. You listen out for things like garbage trucks. When they came through today, I was deeply relieved to discover, oh, there are some essential services still happening here, but there is the very spooky feeling that life really has come to this strange standstill as we all stay inside under orders from county officials.
And Jake, everyone's free to have an opinion on whether it is overkill or not, whether it would hurt anyone if you ventured out. How are you going to get food in your house, for example?
You know, it really is such an important point to be making, Brian, because there is over and over again going to be this sensation of, oh, are we overhyping this? But in the weeks leading up to this, as I was interviewing health officials here in California, where they were taking it very seriously, I kept asking them, are we overhyping this? Are we in the media overreacting in some way? And they kept saying, no. This is a serious situation, and we need you to help us get people to take it seriously. That is very much the vibe of being here now. This feels like what they were talking about suddenly taking place in our life. And so suddenly my wife and I have to strategize in ways that we hadn't thought about before. You go to the grocery store, you don't both go, only one of you goes, so that you do not extend, you know, your risk to a second person. And when you arrive at the grocery stores today, they were staggering out the lines so that no more than 10 people could be in a grocery store at a time. So you had long lines of people in safety masks, in respirators, snaking through the parking lot, waiting to get in to buy the essentials. In our case, we have food laid in for about 2 weeks, we think, but we're definitely going to have to go out again. And what I think about is the incredible fortune I have to be in this wonderful house, you know, with my beautiful children. I can't imagine what it's going to be like for the rest of America.
Indeed. Just after 6 o'clock p.m., Oakland, California, the first of what I'm afraid are going to be many weird dinner hours across that region. Jake, thank you very much for taking time from your home life to talk to us.
Let's go a little bit south from Oakland, California, to the city of San Jose. Among those roughly 7 million Americans who's under this shelter-in-place order now is everybody in the city of San Jose. The mayor of that city is Sam Liccardo. He had a very clear message for his constituents when that order to shelter in place came down last night. Quote, history will not forgive us for waiting an hour more. Joining us now is the San Jose Mayor, Sam Liccardo. Mr. Mayor, thank you so much for being here. We appreciate you taking the time.
Good to be with you, Rachel. Thanks.
So this is a pioneering thing that is happening in the Bay Area. Tell us about the decision-making process, how you were involved in it, and how hard the decision was.
Well, the county health authorities make the formal decision, but I've certainly been pushing for some time that we take this very seriously and be as aggressive as we have to be. It's just a matter of days before our hospitals are going to be beyond capacity. And by that, I mean, we see where this curve is going in terms of the number of patients and who's going to need help. And like every city, we have a limited amount of capacity for ventilators, for hospital beds. And we know where this is going. And so simply, we have no choice. We need to shut it down in order to enable our health system to be able to catch up.
In terms of what you're asking people to do and how you're asking people to change their lives, how have you talked about the issue of enforcement? If people broadly start flouting the advice, if people start disregarding the advice not only about congregating but about being out among other people, what are the plans for how to make sure that basically people obey these strictures?
Well, so far, we've been fortunate. We've got a community that gets it, and everybody understands, for the most part, that this is a matter of importance, supreme importance for public health and public safety. I don't expect we're going to need a heavy hand. For the most part, police officers are going to be out there just reminding folks that they need to follow the rules. And except for the most egregious examples, maybe a St. Patrick's Day party with 1,000 people that I'm not invited to, we'll need to break it up and use law enforcement. But for the most part, I expect we're going to get compliance because people get it. And the police understand that as well. And we're also trying to make sure that people understand the rules, understand the law, because there are some essential functions that are going to continue to happen, and people are still going to go to work at grocery stores, for example, and others who are not. We need to make sure everybody understands it before we do the enforcement.
Mayor Sam Liccardo of the great city of San Jose, California. Sir, thank you. I know this is a trying time. Thanks for helping us understand.
Thank you, Rich.
Almost have to remind ourselves this is St. Patrick's Day, usually a huge holiday, as we need not remind you, in the city of Boston. Thousands of people normally gather downtown for the annual parade, and let's call it the post-game after the parade. But this year, the parade was canceled. The mayor of Boston calling for social distancing.
Social distancing is not a vague wishful strategy. It's backed by science and data. What we do in our city over the next week or two will make big impacts on the local trajectory of this outbreak and our hospital's ability to handle it. It will save lives.
Matty Walsh is the mayor of the great city of Boston, Mass. He's been nice enough to join us live tonight. Mr. Mayor, how did people comply today? How weird does it feel in Boston, in effect, without a St. Patty's Day?
It was very strange, obviously, and I think the whole country is going through the same thing with just, we canceled the parade last week, and for about 5 minutes there was some controversy around it, and then it's forgotten. Today, all of our bar rooms and restaurants are shut down in the city of Boston, in this Commonwealth of Massachusetts, except for takeout. Over the weekend, we had some kids and young people gathering, which forced us to make some decisions on Sunday and Monday. But it's a really strange time right now, and the mayor that was on before and your guests before, I was listening to them, this is something that we've never lived through, and I think that as the days go on and the weeks go on, we're adapting, and we have to continue to lead and continue to show people that we're moving forward here.
Boston is the home of some of the great hospitals in the United States, among them Mass General. They've reported a shortage of some medical equipment. What can you tell our viewers about Boston hospitals specifically being ready?
Certainly, we have some of the greatest hospitals in the world in Boston, Mass General being the greatest, and other hospitals that follow right behind them. I've been in constant contact with doctors and the president of Mass General, Dr. Peter Slavin, and making sure that in the case that we have to make spaces to be able to take care of people, we're working on places now. We're finding places in the city of Boston that when we see these tests come in here in large scale, that we can open up testing areas and assisting the state and assisting the hospitals. I mean, this is all hands on deck. This is something that hopefully no one will ever have to experience in our lifetime again. And I think we have to do everything as we can as a city and as a city government to be in assistance and be on call for whatever's needed.
In normal times, the lead story in the city of Boston would be Tom Brady leaving the Patriots. But tonight, here we are, and this is what we're talking about. Matty Walsh, the mayor of the great city of Boston, thank you very much for being with us.
Thank you for having me.
Steve Kornacki at the big board with Mr. Biden's delegate count. Steve?
Yeah, here you go. You can see we've just added a bunch here from Florida, from Illinois. There are more to come in those states here. Again, there's no official NBC News projection for in Illinois. Let me show you Florida, though, where most of the vote is in. I mean, look at this. This Biden margin here is 61-23 over Bernie Sanders. And remember, in those individual congressional districts, and there's a bunch of them in Florida, you got to be hitting 15% in those to get delegates. When you're at 23, there might be some districts there where that's an issue. And I say that because take a look at the delegate picture right now in Florida. Biden so far taking 133 out of Florida. Sanders just 23. And again, there are a bunch more here still to be allocated. When all is said and done out of Florida, this might be the kind of margin Biden is looking at, about 100, maybe more than 100 over Bernie Sanders out of Florida. We've been talking about this for weeks. The problem for Sanders has been not just that he's losing states, it's that he's losing states big. When you lose a big state by a landslide margin, this is what happens in the delegate picture. And the only way you can make that up if you're Bernie Sanders is not just to win other states. You got to find big states of your own and win those by landslide margins. I mean, again, you look at Illinois. We don't know yet. Our decision desk has not projected it yet. Certainly, these are very encouraging numbers for Biden. But just based on seeing those numbers, you can see what the delegate picture right now, Biden leading with a lot more to be allocated. So far, Joe Biden has added nearly 120 delegates to his national delegate lead over Bernie Sanders. And again, he can get more out of Florida tonight. He can get much more out of Illinois tonight. Arizona is still to come tonight. So you could be in a situation when you get through the end of the night, if Arizona looked good for Biden, we will see. This number could be approaching 300. And in a one-on-one race to make up a 300 delegate gap, if you're Sanders, you got to find your own Floridas. You got to find like 5 of them. And you got to win them, 3 or 4 or 5 of them. And Sanders has not been able to find big states that he can win those kind of landslides in.
Wow. Thank you, buddy.
Thank you. I will say this is the place where these two stories come together, right?
Yep.
That we're talking about this primary, we're talking about the coronavirus disaster and America's handling of it. One of the things that is really serious public health consideration is what is going to happen with these primaries around the country. And if one of the 2 remaining candidates in the race has what amounts to a de facto insurmountable lead, if the race is going to continue all the way to the convention because the guy who's never going to catch up just wants to stay in the race because he's got his reasons of his own, it has a different weight now. It has a different cost now to make that sort of a decision than it would in any other year, because these primaries are only going to continue to happen because Senator Sanders is going to stay in the race, even if he does have a de facto insurmountable lead. And so it will be his decision that forces these very difficult public health decisions on all of these states in terms of whether or not to go ahead with these primaries if there is no hope of him really seriously challenging for the nomination.
You're so right to say that.
And it's a terrible thing to say.
Yeah,
but it's also the reality that we're living with right now. And talking to all of these governors and mayors tonight about the hard decisions they've had to make and the hard decisions they're making going forward about what to put at risk. It's just stakes like we've never seen before.
Absolutely.
Yeah. And to that end, let's talk right now about the great state of Michigan. It's been about a week since Michigan reported its first 2 cases of coronavirus. The state's governor is Gretchen Whitmer. She declared a state of emergency right away as those first cases were reported, actually the night that the Michigan primary happened in the Democratic presidential contest. Well, now all K-12 schools in Michigan are closed. Bars and restaurants are closed. Gatherings of more than 50 people are banned, as is price gouging. As of right now, there's 65 cases of coronavirus in Michigan. There may be more restrictions ahead as the state tries to stop the spread of the virus. Joining us now live from Lansing is Michigan's Governor Gretchen Whitmer. Governor Whitmer, thank you so much for talking with us tonight. We appreciate you taking the time as well.
Glad to be with you.
We have seen these 2 stories come together in your state when we had Michigan's vote totals coming in and the Michigan results coming in, very important in the Democratic primary, at the same time that you were discovering the first cases in your state. Obviously, these are 2 very different things, but you've been contending with both of them as governor as they've evolved on the same time frame.
It's hard to believe it's only been a week, to be honest. I feel like it's been at least a month that we've been working overtime just to try to be as aggressive as we can be to flatten the curve on the coronavirus spread. We knew it was going to come to Michigan at some point, and that's why I ginned up the State Emergency Operations Center back at the end of February, because while it hadn't been here yet, we knew it was coming. I started task forces and declared in a state of emergency immediately. I know how important it is that we are aggressive, and where there's been a vacuum of leadership, I think it's important that all of these governors across the country and mayors, like you've talked to, are taking the bold action we need to protect the public.
You've gone from 2 cases, as we said, that first night when you declared that state of emergency just a week ago, to 65 confirmed cases now. What's the situation in Michigan with testing right now, with both your current status in terms of how accessible testing is, how confident you are in your case numbers because of it, and how quickly you'll be able to ramp up?
Oh, great questions. And we're not like we're not any different than other states. I've been talking with my counterparts, Republican and Democratic, across the country. We don't have enough tests, and we don't have enough resources to make sure that we're able to process the tests as quickly as we need to. And because of that, we are not confident that we have a real handle on how many people are actually carrying the coronavirus in Michigan and where they are and how we can track down the genesis. And that is dangerous, and that's why these aggressive actions that we've taken, like states like Ohio, my friend Mike DeWine, Republican, we've been on the phone talking with one another to make sure that we are using best practices. We're making decisions based on the best science and facts, and always centered around what is in the best interest of the public health. And I'm grateful that I've got fellow governors with which to talk and strategize, because it is so important that we are aggressive on this front end, but we need some help out of the federal government.
The president took some shots at you and has been attacking you personally, even as each of you is trying to weather the state and federal divide in terms of coming up with a response to this. Do you feel like you are able to have a constructive working relationship with the federal government? Does the president attacking you in the middle of this affect how well Michigan's able to respond to what's happening in your state?
Well, you know what? I can't get distracted by that. It's ironic that my point I was making as I was being attacked was that they're not serious, and they're watching TV and attacking via Twitter. That's not going to help anything. The only thing that helps us manage a crisis is having clear and swift information, having personal protection equipment, ensuring that we've got the tests that we need and the resources that is necessary. I have 10 million people in the state of Michigan who are counting on me to be able to deliver, and I need a federal government that's got our back and is helping us do that.
Governor, one last question for you. We've seen, you mentioned Governor Mike DeWine in Ohio, Republican governor, who has been really aggressive in his state. That aggression resulted, among other controversial things, in the cancellation of the Ohio primary, which we expected to be talking about at this time in this place. But one of the things that he's done is he's ordered the cancellation of elective surgeries across the state, simply as a way to free up hospital capacity for what is expected to be this cresting wave of respiratory illnesses and people who need intensive care. Is that something that you're considering in Michigan, and is that the state's role?
Yeah, we are considering it. We've had a lot of ongoing conversation, and Mike is one person, J.B. Pritzker. I could name a lot of different governors with whom I'm talking regularly. We know that to flatten the curve, we have to be aggressive, and anyone who doesn't need to be in a healthcare facility should probably not be, because we want to mitigate this community spread, and that is another way of doing it. And I think that he's done a lot of aggressive things. We have as well, and I think that's why people are looking to the nation's governors to show the kind of leadership we need.
Michigan Governor Gretchen Whitmer, good luck to you and to your state. Thanks for taking time to help us understand your response. Really appreciate your time tonight.
Thank you.
Thank you, Governor. And as we head to a break, we still have a major race in Illinois. Too early to call for us. We'll be going to Chicago. We'll also keep talking to these elected officials, like the governor of Michigan, on the front lines of a galloping health crisis. I'm looking at Steve Kornacki at the big board. I'm looking at our call thus far in Illinois. Biden leading a race that is too early to call. And I'm looking at about 1/5 of all total vote in. Steve, am I correct?
Yeah, you see 20% of the vote in here. As you say, there is no call from our decision desk, but I can tell you, just looking at these counties, everything I was saying a week ago tonight about the vote pattern in Michigan and how different it was from 2016, it all applies almost exactly the same here in Illinois. I'll give you one example of what we're talking about here. College counties, counties where Sanders did really well and ran up the score in 2016, state college towns. This is where Northern Illinois University is here. You see, in 2016, this was Sanders' country. He won this thing by a 2-to-1 margin. Again, tonight, he's just getting crushed here. Still some more vote to come in. But that is the pattern we're seeing everywhere. Take a look down here. This is where Eastern Illinois University is. Again, this was Sanders' country in 2016. Won it by 20 points, now losing by 35 points. Even a place, this was basically Sanders' best county in the state in 2016. University of Illinois is here.
Hey, Steve, can I interrupt you?
Yep.
You'll want to hear what we have to say.
Yep.
We have an update, and that is that NBC News is projecting there is your winner in Illinois. Joe Biden will take that state when all the votes are counted, as Steve Kornacki was busy trying to do.
Whenever you hear Steve Kornacki say there hasn't been an NBC News projection of this, but I can tell you, then you know that you should start warming up.
They can't hear them. They're sequestered.
Warming up the timpani for these sort of things. Steve?
I don't want to try to rush him. It's very important work, but I was wondering when that was coming. Well, here it is. Okay, so Biden, you see, is going to get a very big win here out of Illinois. And again, this is, talk about a reversal. This is what the state looked like 4 years ago. This was Bernie Sanders. Basically, what saved Hillary Clinton 4 years ago was Chicago, the city of Chicago, huge part, and East St. Louis, down in this part of the state, and a few counties here in western Illinois. Otherwise, this was Sanders' country in 2016, and he nearly got a win in Illinois. But tonight in 2020, when I say this is like Michigan, that's what we saw in Michigan last week. You went from a state where Bernie Sanders was getting blowout wins in rural counties, where he was winning big in big college counties, where he was competitive in the suburbs, and it's just a complete reversal. I think, let's see what happens here where Urbana-Champaign is, University of Illinois. But I think what we saw in Michigan last week, right now, we might see all Biden blue in Illinois again. Let's see. It's a little early to say. That's what I'm keeping an eye out for here. But just the vote patterns here. Again, we talked about this blue-collar white voters swinging dramatically away from Bernie Sanders compared to 4 years ago. It just not the same recipe that was there for him in places like Illinois, places like Michigan. And again, you're going to get not just a Biden win here. I think it looks like a pretty big Biden win out of Illinois tonight.
The thought of anyone winning all the counties in a state is so rare politically. The fact that it's happened several times this primary cycle, even more stunning. Garrett Hake is our man in Chicago tonight. Garrett, because when you speak, I listen. I heard you report that at one polling place there today, there was one bottle, albeit a gallon bottle, of hand sanitizer for everybody in every machine. How did that work out?
Yeah, Brian, that's exactly right, and placed at the end of the process. So only after you'd come through the room did you get rewarded with your hand sanitizer at the end here. Look, the City Board of Elections here in Chicago, the spokesperson said today to reporters that they tried to convince the governor not to hold in-person voting in the city today because they knew there would be problems. And starting early this morning, there were problems. Turnout was very low early in the morning, the first couple of hours. A lot of folks went to their polling places to find they were closed because election judges hadn't shown up. Or their polling places normally in a senior center, which was not allowing anyone in, or a private business, which did not want to run the risk of having people coming in and out in the midst of a global pandemic. So there were problems across the city, especially early today. It seemed like it got straightened out across the day. We saw turnout numbers go up across the city all day long. But the preparations to deal with the pandemic were fairly Spartan. Hand sanitizer and wipes for places that had machine-based voting were handed out, but the judges got no real training on this, no real opportunity to implement things like social distancing in the lines. It was all very ad hoc, but the feeling from the state level was that they wanted to get this done today, because if not today, then when? When in the near to midterm future would it be safe enough to hold a primary here? And to that end, Brian, one other thought. 10 days ago, I was standing in this park for a Bernie Sanders rally with 15,000 of my closest friends And now we are where we are, where you couldn't have 15 people gather in a park like this without having somebody stop you and ask you what you were doing here. That's just how fast this has been moving, and the challenge for election officials in states all across the country tonight.
Indeed. Garrett Hake, our man in Chicago tonight. Thanks. Chicago Mayor Lori Lightfoot is with us live from there tonight. Mayor Lightfoot, we're very happy to have you on the broadcast. I understand state of Illinois had 55 new cases just today. Place like L.A. County had 50 new cases just today. First off, how are you doing, and how do you feel the city got through a day at the polls?
Well, I think we're doing as best as we can under the circumstances, and we're going to see these numbers continue to go up, in part because we've significantly expanded the amount of testing that's going on, both hospital-based testing, but also private labs are also coming online. So it's not going to be surprising to see the numbers, because we know that the virus is amongst us. What we've seen in the city of Chicago is about 2/3 of the reported cases are related to travel or people who had contact with people who traveled. 12% are related to community spread. That's unknown origin, but here in the city. And then we're still investigating the remaining percentages. So, but we anticipated this, we're prepared for it, and we're just trying to emphasize to the public the things that they can do to keep themselves safe. Most importantly, if you're sick, stay at home.
I know you're such a big and sprawling city. I have to ask how the first responders are doing in Chicago. I'm aware they're both Dick Wolf shows, Chicago PD and Chicago Fire, but how are they hanging in there?
Well, you know, our folks are tough, they're resilient, and they understand that they're on the front lines on this. We've been trying to get them as much training and support as we possibly can, making sure that they've got the equipment they need to handle difficult circumstances. So again, I think that they're really rising to the occasion based on what we've seen so far, but we need to continue supporting all of our first responders as well as our healthcare workers.
And Mayor, because you're a big city mayor and because you see what has happened in the Bay Area, you hear the talk from New York, I know you've envisioned it. How would Chicago hold up under a so-called shelter-in-place order, what's also known as a lockdown?
Well, look, we're pretty close to that now with the things that we put in place, really starting from Friday, shutting down the schools, closing restaurants and bars, and really emphasizing people working from home. If you go down and walk down in the city of Chicago, like today, like I did, very few people on the street. A lot of our high-rise office buildings are at 25% occupancy or lower. So if we need to take those steps, we definitely will. But in the city, I want to just make sure that we give people time to absorb the new normal that they're facing as a result of the other closures that we've already put in place.
Home of the Bulls and Bears, which it has in combination with Wall Street. Hey, Mayor, thank you very much. We're thinking of you guys during this, as we are all our friends in cities and towns across the country. When we come back, how hospitals are getting ready for what they believe, what they fear is on the way.
NBC News has learned tonight that President Trump is going to be meeting tomorrow with representatives from about a dozen nursing organizations. This comes amid growing concerns about the safety of medical workers, nurses, doctors, EMTs, other healthcare workers who are the first line of defense in this outbreak and whose continued health and ability to continue to work is going to be so key to our nation's ability to handle what is coming. Joining us now is our colleague Chris Hayes, the host of All In on MSNBC, who's been talking about this aspect of the crisis actually from the very beginning. Chris, thanks for being here, my friend.
Great to be here.
You have been talking about this from the beginning, and I know you have been talking with health professionals, not just epidemiologists, but also doctors, frontline health workers throughout, who have been expecting that health workers themselves were going to be a front line.
One of the things that we've seen in Wuhan and Lombardy, the two places that have been hit the hardest, Wuhan, China, and Lombardy, Italy, is that there's a healthcare supply issue that's fixed, ventilators, beds, things like that. But there's also doctors and nurses who end up contracting the virus. And that's bad for two reasons. One, it's bad when people get the virus. And two, it takes them out of the ability to provide care. In Lombardy, it's as high as 12% of the total infections they were treating there were actually healthcare workers.
Wow.
So you've got a situation in which the spread of the infection itself exacerbates the healthcare supply crunch. So what you need are basically three things. You need to set up essentially a separate ward of the hospital and an airborne illness entrance when things get really bad, so you're not contaminating parts of the hospital and other parts, whether they're patients or healthcare workers.
Literally, you have people who have respiratory illness coming in through a different
door. They go to a different part of the hospital.
Yeah.
That was set up. Crucially, and this is the big concern I've heard with ER docs and nurses I've been talking to all day, personal protective equipment. There is not enough. It is being rationed. There are not enough here in New York City. These include masks. These include the full gear that people use. There simply is an insufficient supply at this point. And that's crucial both because of the fear that these folks have that they'll be contaminated and their health be put at risk, but also because you cannot take people out of the, offline when you're dealing with the influx we're going to see in New York City hospitals. It's already starting.
We saw today the announcement from the Secretary of Defense that the Defense Department is going to dip into their strategic supply of medical equipment, among other things, to provide 1 million masks to the Department of Health and Human Services for use in a civilian capacity. And on the one hand, that's great, because that means that there is a secret special reserve where we have these things. But the fact that we're tapping it now at this point means it won't be there in the future when we might need to tap it even more aggressively.
And one of the issues that's been clear from the beginning, whether it's testing or it's this, is coordination and distribution, right? So an announcement at the top means one thing. That's an announcement. Is it in the hands of ER docs in New York City in the next 3 days before they start to see the real capacity issue that they are all expecting? Every ER doc I've talked to in this city is expecting it right now.
Let's bring into the conversation, Chris, Dr. Zeke Emanuel. He's a former Obama White House health policy advisor. He's vice provost of global initiatives at UPenn. And he's got a new op-ed out today in the New York Times, along with 2 co-authors. I want to read you a little piece of it because I think it's actually very helpful. Their op-ed says, in part, quote, "No one knows for sure how long social distancing will have to last to reduce the spread to near zero. But if South Korea and China are appropriate exemplars, we'll need to stay apart now for at least 8 weeks and maybe more." We're going to talk with Dr. Zeke Emanuel about that op-ed and about his work in just a moment. But we are actually going to hit pause on that for a second because I do believe that Vice President Joe Biden is making remarks, and we want to go to those live. Stay with us.
To help their neighbors. And all those children that are home from school that are worried and don't know quite why. Doctors, nurses, EMTs, and public health officials, as well as the frontline emergency workers like firefighters and dedicated folks working to keep the shelves stocked in the grocery stores. Tackling this pandemic is a national emergency, akin to fighting a war. And it's going to require leadership and cooperation from every level of government. And it's going to require us to move thoughtfully and decisively to quickly address both the public health crisis as well as the economic crisis. It's going to require us to pay attention to the medical and scientific and health experts. And it's going to require each of us to do our part. Yes, this is a moment where we need our leaders to lead, but it's also a moment where the choices and decisions we make as individuals are going to collectively impact on what happens. Make a big difference in the severity of this outbreak and the ability of our medical and hospital systems to handle it. I know we as a people are up to this challenge. We always have been. I know that we'll answer this moment of crisis with the best that we find in all of us, because that's what Americans always have done and what we do. That's who we are. Ordinary people doing extraordinary things when the need arises. And today, we are moving quickly to adapt our routines to meet this challenge. Americans in 3 states went to the polls today. I want to thank all the public officials and the poll workers who work closely with the public health authorities to assure safe opportunities for voting, to clean and disinfect voting booths, and to make sure the voters could cast their ballots while maintaining a distance from one another that was safe. It's important for us to get through this crisis, protecting both the public health and our democracy. And today, it looks like once again, in Florida and Illinois, we're still awaiting to hear from Arizona. Our campaign has had a very good night. We've moved closer to securing the Democratic Party's nomination for president. And we're doing it by building a broad coalition that we need to win in November, with strong support from the African-American community, the Latino community, high school educated people like the folks I grew up with in my own neighborhood, labor, teachers, suburban women, veterans, firefighters, and so many more. And we're doing it with a common vision. Senator Sanders and I may disagree on tactics, but we share a common vision for the need to provide affordable health care for all Americans, reduce income inequity that has risen so drastically, to tackling the existential threat of our time, climate change. Senator Sanders and his supporters have brought a remarkable passion and tenacity to all of these issues. And together they have shifted the fundamental conversation in this country. So let me say, especially to the young voters who have been inspired by Senator Sanders, I hear you. I know what's at stake. I know what we have to do. Our goal as a campaign, and my goal as a candidate for president, is to unify this party and then to unify the nation. You know, it's in moments like these that we realize we need to put politics aside and work together as Americans. The coronavirus doesn't care if you're a Democrat or Republican. It will not discriminate based on national origin, race, gender, or your zip code. It will touch people in positions of power, as well as the most vulnerable people in our society. We're all in this together. This is a moment for each of us to see and believe the best in every one of us, to look out for our neighbor, to understand the fear and stress that so many are feeling, to care for the elderly couple down the street, to thank the healthcare worker, the doctors, the nurses, the pharmacists, the grocery store cashier, and the people restocking the shelves, to believe in one another. Because I assure you, when we do that, when we see the best in each of us, we lift this nation up, and we'll get through this together. That's how we've always done it. God bless you all, and my special prayer for those of you in the front lines of the crisis, doctors, nurses, healthcare workers, caring for the virus victims and their families. My prayers are going out for everyone. My hopes are high because I believe in times of crisis, Americans have always stepped up. We have to step up and care for one another. Thank you all. Thank you all for listening.
Vice President Joe Biden on a night that his campaign has, in his words, had a very good night. NBC News has projected tonight that Vice President Biden will win both Florida and Illinois. There was supposed to be an Ohio primary tonight as well. That was called off in terms of in-person voting today at the very last moment after an extraordinary intervention by Ohio's Governor Mike DeWine and an order from that state's health office to shut it down on account of public health emergency. Let's continue our conversation now. We just before Vice President Biden started speaking, we had introduced Dr. Zeke Emanuel, who's a former Obama White House health policy advisor. My friend Chris Hayes is here with us as well as Brian Williams. Dr. Emanuel, thanks for being with us. Let me just ask you. You just heard Vice President Biden's remarks along with the rest of us. Is he saying the right things, the kinds of things you want to hear from a national leader in the context of this pandemic?
Well, it was good to be upstaged by a guy who's showing leadership and, being very presidential. And he is saying the right things. I do think that we can come through this. We lost a lot of time in introducing things like social distancing and the measures we need to put in place to prevent widespread dissemination of the virus when the population lacks immunity. I think, can get it in place. We need it across the country, not just in the focal areas that are showing leadership like Ohio or California or New York. And I think that's the major challenge at the moment, that to get all the states working in the same direction. It's still too much of a checkerboard out there in terms of these policies. And I would also say to your viewers, one of the important things to remember is that the numbers you're seeing today, the roughly 100 dead people who unfortunately have died because of this virus, more than 5,000 Americans who've been infected, those reflect where we were 15 days ago. That the testing is slightly out of date in terms of giving you a picture of what's happening today. And this virus is going to continue to spread and has already spread from those numbers. And those numbers suggest that we have, something like 80,000 cases in the country that we know of, but it's gone beyond that.
Your op-ed today with your co-authors in the New York Times makes a detailed, fact-driven argument about why Americans should not only obey these social distancing orders and recommendations, but we should be prepared to do so for a long time. We should not think of this as something that is a short-term intervention, but something that is going to take a couple of months at least, and we need to get our heads around that now. If, as you say, these things should be happening not in a checkerboard, but nationwide, do you think we can sustain that kind of distancing nationwide for a couple of months minimum in the way that you're projecting?
Well, it's going to be a couple of months minimum. Then we're going to ease them up, and then the virus is definitely going to come back. And we're already beginning to see that in places like Taiwan. And so we would call it a roller coaster that, you know, you're going to flatten the curve, you're going to ease up, it's then going to go up, and you're going to have to put in social distancing again. That's what we have to get our heads around. That's what is going to be the reality until we get a good vaccine out there that can establish herd immunity in something like 50 or 60 or 70% of the population. I don't think most of the public has thought that through. You see, you know, stores closing for 2 weeks, schools out for 2 weeks. No, it's not going to be 2 weeks. I do think governors and mayors who said, well, you know, the rest of the term is going to be canceled and we're going to go to online, they're being much more realistic. And I have to say, if you're thinking about the fall, you got to think of contingency plans for the fall, for schools, my university, the same. I don't think this is going to be one social distancing episode and we're done. And so that is going to put a lot of stress on the economy, and especially those small service businesses where, well, if they can't do it, how you expect a restaurant to stay operative for this social distancing on and off over the course of a year, year and a half until we get a vaccine?
You know, we're in uncharted territory here, Dr. Emanuel, and partly we don't have a good look of what a society roughly analogous to ours looks like on the other side of the curve. The places that have tackled this, like China, obviously using intensely authoritarian means, South Korea, which did this quite differently through mass testing and contact tracing. So I guess I ask you, I mean, is the South Korean model essentially a possibility here? South Korea has not had to resort to sort of mass Wuhan-style shutdowns, or like we saw in Lombardy, or now we're seeing in the Bay Area, because of the thoroughness of the testing and also a bunch of other measures in terms of people with protective equipment and contact tracing and temperature checks at the front of every office building. Is that a future you can imagine here?
I would say we don't know for sure, Chris, and it's a maybe. Remember, they also have the one distinction in that it was a very isolated group.
Correct.
that brought in a lot of it, and we know now that, you know, this is throughout the United States. You know, the president earlier today was talking about West Virginia. West Virginia has no cases. Of course, just to prove him wrong, it had a case, and we all knew that there was going to be a case there. It was just a matter of testing. I'm not sure we can get to South Korea. Now, some of my epidemiology experts say, listen, if we can knock the disease down a lot with social distancing, flatten that curve, get it down, then you'll have a few cases pop up, and we can do more containment type public health interventions. I guess I'm a little skeptical of that, and I'm a little skeptical in part because we travel a lot, because we have 325 million people as opposed to you know, even 50 million people in South Korea. So I guess I'm a little less convinced that we can do what South Korea did. And you know, you are right. They took a different approach, and it did work successfully. But I guess I'm holding my breath because I do think that, you know, now that China's going back to work, Wuhan's going to begin waking up, you're going to see resurgence and recrudescence of the virus, and then they're going to have to do something similar once again. And I'm not sure how we do that, you know, on and off. Maybe the only example we have in history, Chris, is the Black Plague, which hung around for 3 centuries. And you did have this, you know, suspension on, suspension off kind of situation. That's hard to have an advanced industrial economy that way.
Yeah, it is. It's not the greatest precedent.
Yeah, hard to hear the Black Plague being cited as the appropriate allegory.
I did find one positive thing about the Black Plague. Apparently, Newton was sent home from Cambridge, and that's where he began. He discovered calculus while he was at home and began his optics research. Got God willing, all of us will be so creative and so productive and, you know, think new thoughts.
The mother of all silver linings.
Yeah.
Thank you, Dr. Zeke Emanuel. It is great to have you with us tonight. I really appreciate you being here, sir. Again, Dr. Emanuel is a former Obama White House health policy advisor. He's now Vice Provost of Global Initiatives at UPenn.
So our evening continues to careen against these two major stories. We're going to take a break. When we come back, we're going to get a report from the Biden campaign because we are 8 minutes away from polls closing in the state of Arizona. Biden said he didn't yet know how he was going to do there. We have that in common. We don't either. We'll see what happens when polls close out west when we come back.